So there are some real questions that I get asked regularly by my clients and by prospective clients about hypopressives and what they can do for you or how they can help you. So the first one I get asked a lot is, how soon after I have a baby can I start hypopressives? Well, the answer's got three parts. So part one, if you have been doing hypopressives prior to pregnancy with a trainer, then you can start doing the lateral breath, the alignment work and the poses almost immediately. To add the apnea breath to it, you have to wait 6 weeks if you've had a vaginal birth and 12 weeks if you've had a C-section. Second question I get answered. I had my children 20, 30, 40 years ago. Can hypopressives help me? Absolutely. I have had clients who are in their 70s, their 80s, their 60s, their 50s, and every single one of them has had an improvement in continence, an improvement in alignment, and an improvement in their stamina. So it doesn't matter how long ago you had your baby, hypopressives can help you. I have a shelf from a C-section. Will hypopressives help me? I've had numerous clients who have had the leftover shelf from the C-section with the scar tissue. And one of the things that they find most amazing about hypopressives is that it helps to reduce that shelf quite dramatically. So yes, if you've had a C-section, you may not feel that you have a prolapse, you may not have any incontinence, but hypopressives can help you with the shelf. So the next question I get asked is, I've had surgery and I'm waiting for a repair. Can hypopressives help me? Yes, is the answer. Hypopressives can help tone and strengthen both your alignment muscles and your pelvic floor and your pelvic area region, which will help you recover quicker after surgery and may help your surgical repair, pelvic floor repair, wear better than it would if you didn't do hypopressives. So I've had clients who have had to go and have surgery due to stage 4 prolapse, or because the prolapse is just so symptomatic and has been going on for such a long time and it's chafing. Generally it's at stage 4 and they've gone to have surgery, and the recovery time after surgery has been much, much swifter than surgeons have noticed with other clients. So it's a good thing for that too. Can I do KEGELS and hypopressives is another one. So yes, you can. You can. There's lots of tools in your toolbox. You have to think about how you're going to combine your tools. So some trainers teach hypopressives so that when you do the apnea breath, you try and engage a KEGEL or a pelvic floor exercise at the same time. Others, like me, I suggest that you do the hypopressives as an individual thing. And if you want to do pelvic floor exercises like standard KEGEL exercises, then to do them separately, but to keep them as they should be. So doing 10 quick ones, 10 slow ones, and 3 kind of going up the lift. But you should always think about combining exercises because each of us is different. We have to strengthen in different ways. So it's about finding the combination that works best for you. And hypopressives work so well with so many different things like Pilates, like yoga. I use them with balance training and strength work. So we've all got things that we're much, much more interested in and want to get back to. So you can use the hypopressives post a Pilates session or pre a Pilates session, post a run, just to make sure that everything is connecting properly again. Okay. The next one I get is, will hypopressives hurt my sore back? And the answer to this question is, if it's a postural issue, then yes, absolutely. Sometimes it will be a degeneration in your discs, and this is something you'll need to see a doctor about and take further along the medical route. But if it's postnatally, especially post-pregnancy, or if after I say this you go and check it and find out. So for most of us, postnatally, we end up with our rib cage stuck forward like this because we didn't know about lateral breathing. So we've thrusted forward to make more space for our baby in here. And this has created a huge curve in our spine. And this curve in our spine puts loads of pressure into our actual vertebrae. And that's what's creating the pain. So once we reposition you back and teach you how to hold your body better and then strengthen your body through the poses and the breath work, then your back will resolve. The next question I get asked is, how long will it take to resolve or fix my prolapse? Every one of us is different, and this depends on a whole heap of different things. Mine was a stage 3, and my uterus one was, and I had stage 2 and stage 2, so cystocele and recticele, and mine have basically gone. I've got a stage 1 anterior wall prolapse now, so cystocele, but that's it now. My uterus is really high up, so the consistency of approach is very, very important. So if you start a Hypopressives program, you have to continue it. So I do 10 minutes a day as a maintenance program, and so far that's worked for me. But each and every one of us is different, so it depends very much on your connective tissue. If you're really super hypermobile, I'm a little bit hypermobile. I'm hypermobile in my hips, so it depends on that. The more hypermobile you are, the longer it's going to take for recovery to happen. I hope that helps. Next one. Oh, this is a good one. So the next one is, my belly still looks pregnant 6 months after I had a baby. This was me. It's because I had such a massive diastasis and had no idea. When I first started learning all about this, you could put your whole fist into my stomach, and this was the major issue. So after doing Hypopressives, the difference was phenomenal. I went from looking 9 months pregnant, 6 months postpartum, to looking almost like me again. This was one of the most dramatic changes for me, and one that I'm always the most excited about with clients, because it's something you see happening steadily. So if you take a photo at the start, a photo after 6 weeks, a photo after 6 months, you can see the difference in your body. So yes, this will absolutely and utterly help you with that. So I hope these have helped to answer your questions. And any more I can think of, I will send your way, Philippa. I hope you can edit this all right too. See you soon. Bye.